What's up guys, my name is Bryce and welcome to Bryce Games. Today we're going to be playing another surgery game, so let's get started. Alright, so today we're going to be performing a wisdom tooth removal surgery. Now I don't really know too terribly much about this surgery other than the fact that it's an extremely common one. Odds are that most of you have either had this surgery before or you're going to have it at some point in your life, so I thought this could be a really cool surgery to show you guys what actually happens in a wisdom tooth removal. So let's just hop right into the game and gain some wisdom about what actually happens during this surgery. So let's just hop right in. Hey, Dr. Jeff.
Welcome to Surgery Squad's virtual erupted wisdom tooth extraction.
Thank you.
I'm Dr. Jeff, and I'll be walking you through this procedure today.
Hi, Dr. Jeff.
A wisdom tooth extraction is a surgical procedure in which an oral surgeon or dentist removes one or more of your third molars.
It's true.
Commonly known as wisdom teeth.
Mm-hmm.
Most of us have to have our wisdom teeth removed due to chronic pain or discomfort, periodontal disease, or an increased risk of damage to the adjacent teeth. Some dentists and oral surgeons may also suggest that you have your wisdom teeth removed as a preventative measure, even if they're not currently causing you any problems.
The more you know.
Our patient today is having their lower right wisdom tooth removed, or, as a dental professional may refer to it as, tooth number 32.
Yes, that makes sense.
Before we begin, let's get some x-rays taken of our patient's teeth.
Sounds good.
X-rays, or radiographs, are essential, low-cost diagnostic tools used to examine a tooth's roots, check the health of the bone surrounding the tooth, observe the status of developing teeth, and locate abnormalities.
The more
Let's
you know.
get started.
All right, let's
First,
do it.
insert a positioner into the patient's mouth.
All right, great. We're just going to put the little x-ray positioner right into her mouth, and we should be able to take the x-ray right after
Next,
this.
position the x-ray cylinder where indicated.
All right, we're just going to put it right by her cheek so we can get a nice little x-ray of her wisdom tooth so that we can make sure that we do the best job possible.
With the x-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to.
Oh, that's
And
actually
take
a
the
really
picture.
cool fact.
Don't worry, a lead apron will protect our patient from any unnecessary radiation exposure.
Mm-hmm. All done.
I couldn't have done it better myself.
I mean,
I'll
I'm
have
pretty
my
great.
assistant finish up the rest of the x-rays, and then we'll view the resulting images.
Sounds good, Dr. Jeff.
Well, everything appears to be normal with the wisdom tooth's roots.
That's good.
And now that all of the x-rays have been completed, we can extract our patient's wisdom tooth.
Sounds good.
The two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth.
Mm-hmm.
Patients that have two or more wisdom teeth extracted or have impacted wisdom teeth may choose to receive a general anesthetic. When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction. Our
Okay.
patient today is only having one erupted wisdom tooth removed and has elected to go with a local anesthetic.
Sounds good.
To begin, you'll need to apply a topical numbing gel to the anesthetic injection site.
Mm-hmm.
This will help decrease any pain the needle may cause.
I like how they just spawn us with like a giant gaping mouth right in our face. Oh gosh, the tongue moves. That's cool. All right, so we're going to put a little bit of an anesthetic right here so that we can numb the gums before we put a shot in. That is the plan right now. Let's just put that right in there. Oh, yes. Perfect.
Next, we can inject the local anesthetic.
Sounds
The
good.
patient may feel a slight pinch as the needle is inserted. After that, the area will become numb for a few hours.
All right, so now we're going to inject the gum right underneath the wisdom tooth with a local anesthetic so that we can remove the tooth with as little pain as possible. So let's just poke that right in there. Contrary to popular belief, did you know wisdom teeth don't make you smarter? I know, crazy, right? All right, so now we're just gonna wait, let them get numb. And amazing transition music. I didn't even have to edit that in. Oh,
Great.
sorry.
The patient's mouth is numb, and now we can move on to removing the wisdom tooth.
All right, let's do it.
First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator.
All right, so I guess we're gonna be using this dental elevator as like a crowbar to sort of loosen the tooth a little bit by sticking it under and like poking it up a little bit. So let's do that. All right, there we go. Let's just crowbar it out. Oh, okay.
Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed.
I'm not a big fan of dental stuff in general. I'm not gonna lie, guys. Like, I watch The Walking Dead and stuff like that all the time, but when it comes to like dental stuff and like teeth being ripped out, I'm just like, ugh. It makes me very uncomfortable. But okay, so now we're gonna use these forceps. We're just gonna pull the tooth out because why not? All right, so we're just gonna grab it and rotate it out. Yes. Oh, okay. Oh, I love that sound. Oh.
Now clean the area using a surgical suction. This will allow us to check the area for any bony matter or tooth structure that may be left in the socket.
All right, now we're just gonna suck the blood out. We're gonna be a little vampire. It's all good. Oh goodness, I don't know why that makes me so uncomfortable. I don't like it. All right, so now we're just gonna clean it out with some water. Gonna get it nice and clean. Ah, yes, we're just gonna drown our patient a little bit. It'll be good. It'll be fine. Don't worry about it. And now we're just gonna clean it out once again, and we should be able to see if there's any bone fragments or anything left over.
Everything looks great, but we're not done yet.
Okay.
Our patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a clot.
All right, so we are almost done with this surgery. Now we just need to let the patient bite down on these gauze for a couple minutes, and we should be pretty much done. So, yeah, you bite down on those gauze. That was a good minute.
Since the patient is clotting properly, we can go ahead and place some fresh gauze in their mouth.
Awesome. All right, so now that's going to clot properly, and we can put some more in.
When getting wisdom teeth removed, it's important to remember that everyone recovers at different speeds.
Yes.
The rate of your recovery depends on a number of factors, including the complexity of the extraction, your age, and your individual recovery capacity.
And the number of Asian men sleeping beside you, because obviously.
Often, patients will opt to have their surgery on a Thursday or Friday, so they're able to return to work on the following Monday.
That makes sense.
After the surgery, the oral surgeon or dentist will provide some information tips that may help speed up your recovery. These tips may include using an ice pack on the outside of the cheek for the first 24 hours.
It looks miserable.
Refraining from physical activity for the first few days. Avoiding sodas and the use of a straw.
Okay.
And gently rinsing your mouth out with warm salt water to help relieve pain after the first 24 hours.
All right, cool.
It's also suggested that patients do not smoke for at least 24 hours after their surgery.
That makes sense.
Smoking may not only delay healing, but it will also reduce the blood supply.
Yeah, it can thin your blood.
It could introduce germs and contaminants to the surgery area. And that's a wisdom tooth extraction.
Hey, we did it!
You did great. If you're up to it, why not try another procedure on surgerysquad.com?
No, thank you, Dr. Jeff. I think I have had enough surgery for today. All right, guys. Well, it looks like we have successfully completed the wisdom tooth extraction. I think that means that we are clearly very wise. If you guys enjoyed the video, then make sure you give it a like because it really does help me out a lot. And make sure you hit that subscribe button so you can see my new videos as soon as they come out. If you guys would like to see some more surgeries, then make sure you guys click the link that's on the screen right now so that you can see all the surgeries that I've done. I've done quite a few, so make sure you guys check them out. But anyway, thank you guys so much for watching. I'll see you all in the next video.